Thank you for joining us. I'm Leesburg City Commissioner Dan Robuck, and I'm here with Lakefront TV's special coronavirus report. Now, this is the second episode that we filmed. The first one was almost a month ago, but it seems like a lot longer. The world is certainly a different place. When we filmed that first episode, there were less than 2,000 cases nationwide. We didn't have any confirmed cases in Lake County. But today we've got 119 confirmed cases in Lake County, and we're almost up to 400,000 nationwide. And unfortunately, those numbers are continuing to grow every day. Fortunately, I am here today, and I'm joined again by Dr. Berger, who is the Chief Operating Officer and Interim Chief Medical Officer with UF Health Central Florida. Thanks for joining me again, Dr. Berger.
Well, thanks a lot for having me.
I thought we could kind of start at the beginning and talk, once more about what is the coronavirus, COVID-19, what does that mean?
So COVID-19 is actually what the disease is called, and it's caused by a virus, a class of viruses called coronavirus, and in this specific case, it's called SARS-CoV-2. And coronaviruses are very common. In fact, about 10 or 15% of all common colds are caused by coronaviruses.
Okay, perfect. What do we know about how it's spread?
So the way the SARS-CoV-2 or COVID-19 is spread is a few different ways. First of all, it's spread on droplets, which occur when people cough, or it's reported also singing or potentially talking. So someone who has the disease, who coughs, the virus usually lives on droplets and can then travel in the air to the next person. It also can live on surfaces. So if someone who has the disease coughs or touches a surface, it can live on surfaces for up to 3 to 4 days, and certainly by human contact, touching someone who has the disease, it can also spread coronavirus.
Okay, now I saw in the news yesterday that a tiger had it in New York. What about pets? Can I get this for my pet?
So there have been reports of animals and pets and even household pets testing positive for coronavirus. It's unknown if it can spread from the pet to a human, but certainly the fact it's been detected in animals and pets is concerning.
And then you mentioned surfaces. So my mail or packages from Amazon, do I need to be wearing gloves when I handle those?
So it certainly can if the delivery person is coughing and coughs on the package. Potentially the package can transmit the virus. So usually what I do and what I advise my family to do is when they get a package to wipe it down before they open it, and that should solve the problem.
Okay, that's some good advice. Now, when someone gets COVID-19, what are the symptoms and kind of what order do those generally appear in?
So about 80% of people who get COVID-19 actually get fairly mild symptoms. It's the 20% that get severe symptoms that you have to really be concerned about. And the usual symptoms are severe headache, a cough, a fever, and then people who are developing really severe symptoms can get short of breath and severe shortness of breath. Interesting information recently is that coronavirus can actually present with GI symptoms as well. So in a small percentage of people, they will have potentially nausea and vomiting or diarrhea, but that's pretty uncommon. We've also seen in about a third of people that there's some effect on the taste or smell that senses. So people are saying that they have decreased taste and decreased smell sensation, and that's seen in about 30% of patients. Also, some patients, and about another third, can get redness of the eyes and conjunctivitis. So there's a whole list of potential symptoms, but the most common ones are usually headache, fever, sore throat, muscle weakness and pain, and then the concerning one is shortness of breath.
Okay, so it seems like we've maybe learned a lot since the last time we spoke. I don't remember the smell and taste stuff even being out back then. Is there anything else about the virus that we've learned over the last month?
So we've learned a lot in terms of how it presents, and I just mentioned some of the presenting symptoms. We've also learned that a significant percentage of people can be completely asymptomatic. So that's one of the reasons why we've started to advocate that everyone wear masks when they're out in public, because potentially you don't know whether or not you have it, and interacting with people who are completely asymptomatic can still spread the disease. We know that the disease is most contagious very early on, that symptoms usually develop within 5 to 8 days of being exposed. We know it usually lasts about another 5 to 8 days. And patients who get really sick, it's usually about a week after symptoms start. So we've seen patients who are initially screened, are tested, but sent home, who then come back to the hospital with progressive disease, and that's usually seen after a week. We also know that patients who end up in the hospital on ventilators tend to do very poorly. And what we've seen, especially in Florida, is that patients over the age of 65 are at risk of getting coronavirus, as well as developing complications from coronavirus. So if you look at the current statistics in Florida, about 55% of patients in the hospital for coronavirus are over the age of 65, and 80% of the patients who die from coronavirus in Florida are over the age of 65. So that's really a very vulnerable population. So we've learned a fair amount since we first spoke a month ago. The other thing is there's some treatments that are being looked at. Most of them are still in experimental phase. We're using hydroxychloroquine a fair amount, and we're using that in patients who get admitted to the hospital and have respiratory symptoms. The other things that are being looked at now are antiviral medications, such as remdesivir. We're also looking at using what's called convalescent serum, meaning collecting blood and serum from people who have had coronavirus in the past, and then spinning that serum down and giving it to patients who are critically ill from coronavirus. And the theory being that there's antibodies in that serum that can be used to attack acute infection. So there's really a whole host of things that we've learned. Certainly we don't know everything at this point, and still are doing a lot of clinical trials to really find out what's the best treatment and when should people be treated.
Okay, now you mentioned that people over 65 are at a higher risk, and especially in Florida, that seems to be a large part of the hospitalizations. Some of the things I've seen in New York is that they kind of have a surprisingly large number of young people being admitted. Are there risk factors for young people that make them more likely to have a serious infection?
So for anyone in general, some of the risk factors are anything that really reduces your immune system and immune response. So people who have Crohn's disease and are on medications like Remicade for Crohn's disease. People who have cancer, especially people who have gotten chemotherapy or radiation in the recent past, also are at risk. Diabetics, people with high blood pressure, but there have been some young people with no known risk factors who have gotten the disease as well and have done poorly as a result of the disease, and it's still not known specifically why those young people have succumbed from coronavirus.
Now, if you know you're a high-risk individual, either you're over 65 or you have one of these underlying conditions, are there steps you should be taking to protect yourself?
Stay home. I think that's the number one thing. And I spoke about it last time. My mom, who's 83 years old and has respiratory issues, she's been in her apartment now for about a month to protect herself. My wife does a lot of volunteering and has been going shopping for some of the older neighbors in our community who can't get out. But the one thing I would say for older people is if you can stay home, stay home. If you have to go out, wear a mask. Make sure you wash your hands or use some type of hand sanitizer very commonly, but stay away from anyone, meaning keep a distance of at least 6 to 8 feet. But the most important thing you can do if you're in a high-risk group is stay home for now.
Okay, that's some great advice. And now you mentioned masks, and I know that since we last spoken, the CDC is now recommending that people wear masks in public. And now, obviously, the N95 masks are still a shortage, and we need to be prioritizing those to our frontline healthcare workers. But when it comes to cloth masks, can people make their own?
Yeah, so there's some great videos on YouTube or all over the internet about how to take a simple bandana and with 2 rubber bands make it into a very, very effective mask that has 8 layers. So it's very, very simple to make a homemade cloth type mask. And I would recommend everyone when they're out in public right now to be wearing a mask because it protects you, but it also prevents you from spreading it to the next person. So it's sort of like a community initiative. If everyone out in public is wearing masks, I think it has a dramatic impact on the spread of the disease.
And now, so if I have that cloth mask and I go out in public and I come back and now I want to reuse it, do I wash it? Are there specific things I do to sterilize this?
So actually, the recommendations are just to launder it as per the manufacturer's recommendations. And if you can turn it up on a higher temperature when you're doing your wash, that's advantageous. But a simple cycle through the washer is recommended and will disinfect your cloth-made mask. When I got home, I wouldn't run through the whole house and touch it. I would make sure if I was going to take it off that either I had gloves or I washed my hands immediately after I took it off and drop it right into the washing machine.
Okay. Now, one of the kind of words that everyone's throwing around lately is social distancing. What exactly does that mean?
All social distancing means is that you keep a safe distance between you and other people wherever you may be in public. So for what's really recommended is at least a 6-foot distance between you and the next person. And that's because it's been shown in multiple studies when you cough, you can propel various droplets to a distance of 6 feet. Beyond that, it really does not occur. So 6 feet, at least 6 feet is identified as a safe distance.
Okay. And so with the social distancing, now Florida has the stay-at-home order all the way through the end of April, the travel restrictions. How do these things, these policies, how do they come together to help stop the disease?
Well, really the way they help and they all come together is by decreasing the transmission from one person to the next. We know that COVID-19 is highly communicable, meaning it can go from one person to the next very easily. And it's about 2.5 times more communicable than the common flu, which we know is very easy to transmit from person to person. So this is 2.5 times the routine flu, so very, very communicable. So by staying at home, reducing contact with others, social distancing if you have to go out, wearing masks, you're decreasing the transmission of the disease, which is the key right now, since we don't have really an effective treatment and we don't have a vaccine.
Okay. also now with a lot of cases in Lake County, and certainly some of them have been hospitalized. What steps is UF Health taking to deal with the patients coming in and protect other people at the hospital and staff?
So we've been at this for about 5 weeks now and have a whole host of measures that we've put in place. One of the most important things we did is we've set up a telehealth line. So if people are having symptoms or have questions, they can go onto our landing page for our webpage, and there's a number they can call if they have questions or if they have symptoms, or if they have symptoms and want to get tested, they can call that line. So helping inform the community about what's going on and giving them access to healthcare without having to leave their home. So that's one thing. The other thing we've done is we've established a very streamlined process for screening at both our urgent care as well as all our emergency departments. And the minute someone comes in, we put a mask on them if they're having any respiratory symptoms, and then we're triaging them and evaluating them for other respiratory illnesses. But right now, anyone who comes in with a respiratory complaint, we're doing the COVID-19 test on them. We've given masks to all our providers in the hospital. We've unfortunately had to restrict visitation because of some of the things I told you before. We don't know who's symptomatic, and we know that people who are asymptomatic can be carriers. So to protect the patients in the hospital, as well as protect our staff, we've had to stop visitation except in really special circumstances. We've created individual hospital units where we only have our COVID-19 patients. So both on the unit as well as people who need to be in the ICU, we have specific areas that just have COVID-19 patients. And that's to protect the rest of the patients in the hospital and to make sure that we use our personal protective equipment for our staff properly. So only the staff that's going into those areas with those patients needs to have the PPE. Probably one of the most significant things we've accomplished, which has made a huge impact on our fight against COVID-19, is testing. We now have the ability to test people in the hospital. We have our own testing set up, and we can turn around the COVID-19 test in about an hour, 45 minutes to an hour. And that's dramatically reduced the number of people we have in the hospital who are called patients under investigation. And now we only have a handful of those patients in the hospital, and the rest of the time we can focus on our patients who are actually COVID-19 positive. So by having that rapid test that we can do in the hospital, we've eliminated the need to put these people in isolation. We've been able to save our PPE and really focus our efforts on our COVID-19 patients. Another important thing that we've done is we've established a virtual ICU. So we're partnering with University of Florida up in Shands, and their critical care experts via telemedicine are helping us to take care of the patients that we have in our ICU. So providing that extra layer of expertise to help us guide therapy for those most critically ill patients.
That's really great news about the testing and also the collaboration with Shands and having that resource right here in Lake in Sumter County. Now, we obviously don't want everyone going to the hospital to get a test, only those that are need to go to the hospital. So who should be thinking about getting testing outside of a hospital, and where should they go?
So right now, the people who are being tested are those people who have symptoms. So if you have a new onset of a cough, you have a fever, you have any shortness of breath, any of those symptoms, there are several avenues for you to get tested. One is you can schedule a telehealth appointment with our urgent care, and that number is posted on our webpage. The other places to go are the Lake County and the Sumter County Departments of Health. I have those phone numbers. For Lake County, it's 352-742-4830. Again, 352-742-4830. And for Sumter County, it's 352-569-3102. That's 352-569-3102. And they both have the ability to do the testing or refer you to a testing center. So there's now a lot of resources doing testing, but we're still focusing on doing testing on symptomatic patients.
That makes a lot of sense. But now what if I don't have symptoms, but I know I've come into contact with someone who's been diagnosed with disease? What steps should I take?
So if you know that you have come in close contact, the thing to do is quarantine yourself. So remain at home and monitor yourself in terms of your temperature. The recommendation is to take your temperature twice a day, and the time period for quarantine is usually recommended to be 14 days.
Okay, great.
And certainly, if during that period of time you develop symptoms, then you contact one of the numbers or sources I gave you to get tested.
Right. Now, we've seen stuff in the news about shortage of N95 masks and some other things. If people do happen to have those lying around, is the hospital here taking donations?
So we are taking donations, and certainly you can call us and
Hospital Foundation.
the Hospital Foundation will take any of the donations you'd like to make.
Okay, great. And before we end, is there anything else that you'd like to add?
So it looks like from the various models out there that the social distancing and the stay-at-home order appear to be having an impact. It looks like, whereas the peak was estimated to be sometime in May, the peak has moved up, and what we're seeing is potentially a flattening of the curve, which has been described in multiple news sites and on multiple different media outlets. And what that means is that fewer and fewer people with the disease are being seen. And that's really key to being able to move forward from this. So the good news is that our social distancing, our stay-at-home order is having an impact. The bad news is this is still going to be a few more weeks of having to live like this. So optimistic that we're seeing a break, and not necessarily the dire scenarios that have been predicted, but we need to continue doing what we've been doing in order to really make that impact.
Some really great advice. Well, thanks again for joining us. I know you've provided a lot of really valuable information, and it's great to be able to end on a little bit of an optimistic note that things do seem to be improving. We can't let up. We've got to be diligent with social distancing, washing hands, staying home if you're at risk. But by doing all these things, we're going to get through this and come out on the other side. So with that said, I'm Dan Robuck, Leesburg City Commissioner, and I appreciate you joining us.
Thanks, Dan.
Thank you for joining us on this special coronavirus report. It's really important that you stay up to date. This is a situation that's changing literally by the hour. When you do that, though, it's important to get information from reputable sources. So a couple I suggest is the Florida Department of Health. That's floridahealth.gov. There you can find a link to a map showing all the county-by-county information, both on cases and on testing. Also, CDC has some great information as well about things going on in the U.S. If you want to see about the whole world picture, ourworldanddata.org has some really great information. You can link right into the Johns Hopkins feed, as well as a couple other great data sources. So make sure you're getting reliable information. It's important to know what's going on so you can stay informed and stay healthy. Thank you.